This harness is called the Sturdy harness, and it allows for more trunk control. It is more comfortable for the patient, and it has pivots that allow the legs to move freely while still suspending the weight of the patient. It's very strong. It can accommodate a wide variety of patient sizes. We can also customize these for individual patients or for different population sizes. So we're going to put the shell on. Keep these off directly on the side of the hip joint. And you put the harness on low around the waist. Okay. For ambulatory patients, you can put it on standing. For patients in a chair, you can try to put it on in the chair. A lot of times it's easier to transfer the patient to a mat. Now we're going to put the leg cuffs on. The left leg cuffs are made in a cone shape, which prevent them from riding up the patient's leg. They have a number of clips, and so we tighten as we go up, and this transfers a lot of the patient's weight from the leg through the harness up to the hoist. This type of harness eliminates the groin straps between the legs and makes it a lot more comfortable for the patient. So this is the right side. Turn. This up here. Loosen these. And donning the harness for an experienced operator does not take long at all, just a few minutes. So here. And tighten it here. And tighten. Tighten. Tighten, tighten, and tighten. All right. Next side. Same thing. Lined up, and we tighten. You see now it's comfortable on the patient's leg and it cannot ride up, so we transfer the weight up. Now she's going to get into the machine. Open the robotic legs, open the cuffs. Raise the hoist up a little bit. Okay. Lower the hoist just above the patient's head, just a few centimeters above the patient's head. Connect the patient. The hoist. Tighten. Now, if the patient is in a wheelchair, you simply roll the wheelchair up on the ramp, lower the hoist all the way down, connect the patient, and you can raise the patient directly out of the wheelchair. Now we're going to connect the hip stabilizers. Therapists don't normally like to limit hip rotation, but when you're attached to the robot, it creates some unnatural hip rotation. So we use these hip stabilizers, but they have springs in them that allow the patient to have some movement. So you mitigate the abnormal movement, but you don't